Welcome back to Daytime. Now that I have maybe some teeth knocked out from playing some dodgeball, we are going to be talking dentistry with Georgian Dental. And joining us, we do have Dr. Adam Tan as well as Jeanette Tanner joining us to tell us a little bit about what's new, what's hot, and how to be taking care of your mouth to your optimum health. Thank you very much for being here and joining us. Thank you.
Thanks for having us.
So when we talk a little bit about dentistry and the evolution of it all, there's definitely been some changes in regards to the way that we are looking at our oral health now. Isn't that right, Doctor?
Absolutely. Dentistry is changing at such an incredible rate these days, and our patients are becoming more and more informed, especially with what they can find on the internet.
Yeah.
There's a lot of information on there, and there's a lot of disinformation on there. And more than anything else these days, you need someone with professional training to be able to guide you in the direction that is probably the best for you.
Now, when it comes to Georgian Dental, you have an added bonus, I will say, in regards to your way of holistic nutrition and your holistic dentistry. So, Janet, tell me a little bit about your role at Georgian Dental.
So at Georgian Dental, my role there is a holistic nutritionist as well as a holistic dentistry advisor. Mm-hmm. So I advise our patients when they come in if they have any questions or concerns about the materials that we use, the services that we offer that are more compatible with the human body. So,
and I love that because really we just think of our teeth to be able to chomp down what we need to digest, but that's not the case.
It's certainly not the case. What we've done is we've broadened the scope of what dentistry does for our patients. So it all begins with what you put into your mouth. And well, dentistry was great in that we fixed teeth, but that was only the beginning of the entire journey. What really happens then is, you know, it depends on the kind of foods that you eat, making the right choices, you know, staying away from the high sugar diets, all of the things that seem to make common sense, but there's also new information that's coming on the scene. You know, what we're finding these days is we're seeing that there's certain food groups that we want to really stay away from, some that have been genetically modified over the years.
Yes.
You know, they may not hold the kind of nutritional value that they used to have maybe a few decades ago.
Exactly, and we're going to talk a little bit more in regards to that genetically modified and maybe some other food groups that you're going to want to stay away from. So Stay tuned, but we're going to throw it over to Alex, who's going to actually show us how to be doing the proper dodgeball. Alex?
Yeah, you know what, I have to admit, I'm always a little nervous talking to dentists and stuff like that, just because, you know, it's a hush-hush topic. But you know what, I got a couple great people here that are all great from Georgian Dental. So we're back here with Adam and Janet. I want to know, Adam, so you have your everyday, you know, mainstream dental practice. I mean, how did you two kind of get together, you know, just quickly?
Simple terms, I started noticing certain things happening to myself while I was practicing dentistry that were not appropriate in terms of my age. Like, for example,
Memory-wise.
Memory was going. I couldn't remember, you know, I was hunting for words in seminars that I was doing. I started to forget names. I would forget my patient's name, heaven forbid, right?
And it had to do with, you said mercury in your mouth.
I did a little bit of research and I found that one of the biggest things that I was exposed to as an environmental toxin as a dentist was mercury. Well, you know, it's not necessarily, well, it is in a sense, because, you know, it's not so much the mercury in my mouth, but it's the mercury that I'm taking out of my patient's mouth and the mercury that I was putting into my patient's mouths. So when I was back in dental school, they taught us, well, it was safe. All of that stuff is actually locked into your filling.
Wow. So then you went and you found that the memory was going, and then you and Janet got together. We'll talk more about that coming up on Daytime. Welcome back to Daytime, back here with the people of Georgian Dental. And just before the break, we were talking with Dr. Tan about, okay, you found yourself and you were learning all about mercury and how it was affecting your memory. So at that point, you went and you were talking to naturopathic people, and then we got connected with your own receptionist or at that point, right?
Absolutely. It was very much serendipity. And I believe a lot of that, you know, everything happens for a reason. So, you know, Janet came on the scene with her expertise in holistic nutrition.
Excellent. How have things changed, I guess, since then? How has it been for you working at the same place and then kind of suggesting different avenues? We're thinking, you brush, you floss, whatever that is, you're helping people out in different ways now. How so?
It's certainly a passion for me. I want to see our patients grow. You know, it's basically working with the patients before they see Dr. Tan. So I want to make sure that their nutritional capacity is at its fullest, is optimal before they come and have any sort of mercury amalgam removal or any other services that we offer that are holistic.
Just to kind of give you an example, for example, if a patient came to me for safe mercury removal, before we can actually do anything like that, I oftentimes will highly recommend that they seek Janet Tanner's expertise just to figure out what they can do to prepare themselves for the process.
How has that changed? I guess, you know, the office there, I mean, how has it changed from when you didn't have her involved in this capacity to now?
Tremendous. I mean, our approach has been, well, what works with our patient? What is biologically compatible for our patients? You know, what is friendly? What causes an inflammation? We've kind of eliminated from our practice, and what helps and creates overall health in our patients' bodies. Well, we've tried to bring that into our practice as well.
And it actually makes it a healthier environment for the employees as well.
Very much
Excellent.
so.
So it's overall. So we're going to be back more a little bit later in the show with Georgian Dental, but now we're going to talk a little social media with Mel.
All right, Alex, we are having lots of fun here with Georgian Dental, and we are talking, of course, some people are maybe fearful when it goes to getting that procedure at the dentist. Well, there's different options, and we do have Janet as well as Dr. Adam Tan. Now, when it comes to different procedures, different ways that you're able to maybe help people to relax in the dentist chair, what would we be looking at?
Well, when it comes to nervous patients, one of the things that we offer our patients is different levels of and options for sedation. You want to put this on?
Yeah,
for me?
I do.
Yeah, here we go. So one of the things that we do is offer laughing gas for our patients who are really nervous.
Can I pick this up?
Sure, absolutely. We'll bring it over.
Just bring it over here,
Absolutely.
maybe a little bit more. All right, so this is what I'm attached to right now?
What you're attached to is called a patient monitor. And in simple terms, what it does is it measures your blood pressure, your oxygen saturation. Looks like you're dead right about now.
Yes, exactly.
Okay, so your readings are coming up. You're looking great. Oxygen saturation is as high as it can go. Heart rate's excellent, so you must work out. You're doing a lot of that yoga, so that's always working. And then what it does is it takes a blood pressure reading every 5 minutes so that we can keep a real close eye on our patients, how they're responding to our sedatives, and make sure that they're nice and safe. What we do is we bring a nurse in, and all she does is she keeps an eye on your vitals. She makes sure that there's the chest rise, you're breathing, and your vitals are where it should be. So we keep it nice and safe, and it's a great option because otherwise our patients who are super nervous about coming in to see us really use that as a hurdle and an excuse not to come in.
Yeah, exactly. That's exactly it. So there's no reason not to get in there. Right. And obviously, I've heard a lot in regards to laughing gas and different options. I've always wanted to try laughing gas. Is that weird? Sorry, I have. Did you bring any?
No, I didn't bring
okay.
any. It's a little difficult to transport this up. Here, I'll hook you up with this.
Okay.
So that goes against your arm. And what we'll do is we'll hit the button. Where did it go? Here we are. I feel a little squeeze.
And this is my blood pressure?
This is your blood pressure. And what we do in the province of Ontario, what we're required to do is we take a blood pressure reading every 5 minutes just to make sure that we can track what your current blood pressure readings are like at this very moment.
Okay.
So it's gonna squeeze that arm, and then we'll get an automated reading in a couple of moments.
And see what my blood pressure is like.
Yeah, we'll see.
I'm thinking calm thoughts.
Okay, perfect. 140/89.
What's that? That's
so it's a little on the
high.
high side. It's a little on the high side, but it's still within what's considered normal range.
Yeah. Well, it's funny because I was just talking to my mom. She had hers tested yesterday, and hers was perfect. I was like, oh, I'm probably perfect too.
Well, you know what it could be? It could be because of your sleeve.
My sleeve.
That throws it off as well.
That's what we'll say.
Okay.
We'll get it checked a little later. Now, when it comes to, if you can, sorry, Janet, but her teeth are amazing. Like absolutely straight, perfect, white, wonderful. Exactly what you'd like people to see when they first come to an office, right?
Ones.
So there's different options when it comes to making sure that we are able to
Absolutely.
get a straighter, nicer smile. Cosmetic dentistry is huge, right? So let's talk a little bit about some different options that we have.
Terrific. Well, when it comes to straighter teeth, one of the things we have to realize first and foremost is that when you do have crowding in your teeth, what happens is you're at a higher risk for developing chronic gum infections. There was a study that was out of the UK not too long ago that found that there was a direct correlation with the amount of gum disease that you had and the degree of crowding that you had in your mouth. What we found was that these crowded teeth did contribute to chronic gum infection. So what we wanted to do was bring in some options for our patients to be able to have healthy smiles. And one of these options is what you see before you, and this is a system called Invisalign, and it's a way to straighten teeth, and we like it because it's very much in part with our holistic concept. The materials that are used that go around
These are
these
braces. If you're
That's right.
basically, I mean, instead of the big wires in your mouth, you got this.
Precisely. So what happens is it's a tray-like material
Wow.
that fits around your teeth, and it's nice and clear. The material itself is great in the sense that they're always researching and improving the kind of material that's being used. But the long and short of it is that it's BPA free, so we like the stuff. It does what it's supposed to do. And the beauty of it is that it fits over your teeth so that when you're smiling on other conversational distance, you really don't see it, and you can be in an active course of treatment. And some of my patients who are CEOs or in sales and do a lot of presentations, you can pop them in and out of their mouth and perhaps go for a wedding, have some photographs taken and pop them right back in again. Super convenient.
Wonderful.
Love it.
Exactly. Lovely. So many different options. We're actually going to take a short little pause. Oral health is in April. April is Oral Health Month,
That's right. Absolutely.
And we're going to talk a little bit more about why you need to get to the dentist today. Right after this. Don't go anywhere. More with George and Dental in Daytime coming up right after this. Is this thing on? Welcome back to Daytime. We're here with George and Dental. We're talking holistic dentistry and all the wonderful options that are in dentistry these days. Now, Janet, we're talking in regards to different seminars that George and Dental offers. What are these seminars?
Okay, so once a month, it's usually at the end of the month, I hold a holistic seminar, and it's a different topic every time. In September, we did a back to school. It's packing healthy lunches for your children. We've also done holistically healing cold and flu season.
Yeah.
So there's just a different amount of subjects, and we're actually hosting one tonight. Dr. Tan is, and it's on the mercury myth.
Oh, so if you want to hear more about the mercury that we were talking about, and Alex, why don't you come on in here, because he was talking about it. So come on in here, so people can maybe.
Absolutely. The seminar itself is being held tonight over at our practice at 149 Bayfield, and it runs from 7 p.m. and it will go until about 8 p.m. and we'll have a Q&A at that point. In simple terms, what I'll be doing is I'll be going over some of the processes and unique processes that we use in our practice to safely remove mercury. We'll review some of the benefits and disadvantages, and we'll try and be as all-encompassing as possible. We'll try and present two sides of the coin.
And that kind of brings us to this machine that you have at George and Dental as well. So what are we looking at here?
We've been looking at this the whole time.
Yeah.
I've been just being like,
Big
hey, whose
molars.
teeth are these, by the way?
Well, these are a sample patient.
Okay.
But what it is
They're not your teeth.
They're not my teeth. I don't have a crown like this. But what it does is it provides for our patients an option, a choice. In many ways, it goes back to our treatments with replacing mercury in our patients' mouths. In the past, I mean, till this day, there are some doctors who still place mercury, and that's fine. They make the decision that's what's going to be best for their patient at that point. However, we've chosen not to continue to place mercury in our patients' mouths, and we've chosen to actually remove them when the time is appropriate. So at the point when it comes to when we need to remove these mercury amalgams, well, we need something else that will actually replace it and do that in a way that's predictable and behaves as a natural tooth would.
Right.
This is where this technology comes in.
So what's happening here? Is this the mercury, the blue spots? Or
Well, what it is the yellow that you see is actually a three-dimensional cast of the mouth
Okay.
of this particular quadrant of teeth. The white thing that you see is a crown that has been designed to cover over what is left of the tooth that used to have a mercury filling in it.
Okay.
Now, the interesting things with these mercury fillings is that they have a certain lifespan to them. They usually last anywhere from 5, 10, up to about 15 years or so. And then what happens with these teeth with fillings in them is they start to fatigue and you start to see craze lines on them. Now, if you fast forward a few more years, if you go to 20, sometimes the teeth themselves will start to break. Part of the reason is that mercury, being a metal, expands and contracts and it weakens the tooth structure.
Excellent. And then, so there's an acceptable level of mercury at this point, but at that point, if you're ingesting your filling at some point because it's broken out, that's not necessarily a good thing.
It's not necessarily a good thing. When we look at what is safe for mercury levels, what we oftentimes go to is the recommendations by the Canadian Dental Association. So if you go to the website, you'll see that they have a certain recommendation for what is safe, what is a safe level for mercury, the number of mercury fillings that you can have in your mouth and what isn't. And that's part of the seminar that I'm giving tonight.
Oh,
Awesome.
Wonderful. Fantastic. And this book, Reveal the Secret Truths to a Healthy Body, Start with What You Put in Your Mouth. Where can people get this book if they want a little bit more information?
Terrific. If you go onto Amazon, it's on Amazon, so you can purchase the book at that site. What we're doing is we're actually donating all of the proceeds from the sale of this book to a charitable organization that helps new authors.
What's happening
This was
here?
the laughing gas. Oh, you want to put it on,
Wait,
don't you?
this is laughing gas? This isn't laughing gas.
That's not laughing gas. What
No,
it is.
you're putting it on wrong.
You're putting it on
You
upside
had it
down.
right the first time.
So what
There
it
you
is it's a mercury canister. And
wait, what?
Mercury vapor filter canister.
Okay, so it'll test the mercury levels.
Well, what it does is it filters out any of the ambient mercury that is in the air, in the environment. So what we do as part of our safe mercury protocols is we actually wear this, not the patient so much, otherwise we can't get into their mouths, of course,
Okay.
but the doctor and the dental assistant. So what we're trying to do,
wear those?
we have to wear this to create a safe working environment, because what happens is when we're removing some of these fillings, there's heat that is applied to these teeth.
And people are going to have to just join you and find out more
Learn
because
more
there's
about
so
all
much
this stuff.
information.
There's a lot of information on it.
Oh my gosh.
You can find a lot of information online, but the fact of the matter is that there's a lot of information and disinformation. So what we're trying to do is kind of clear up all of that information, bring the truth to the surface.
Exactly.
Excellent.
Thank you so much. Thank you for joining us. Wonderful
you.
information.
Pleasure.
Holistic dentistry. It's the way of the world. And
Your
I
health
learned a lot
starts with
today.
your chompers.
That's true.
Absolutely.
Thanks very much for watching. Go do something productive with the rest of your daytime, and we'll see you again
What's
tomorrow.
happening there?